want to bring to the stage a friend of public health and this year's recipient for the Presidential Citation, Dr. Risa Lavizzo-Mourey. The APHA Presidential Citation is not awarded every year, and it's only on special occasions that we're moved to give this award. Dr. Lavizzo-Mourey, as you know, is the president and CEO of the Robert Wood Johnson Foundation. She's a national leader in transforming America's health system so that people can live healthier lives and receive needed health care. She's being recognized in particular for her deep commitment to health reform. Throughout her work in academic medicine, government service, and now at the foundation, she has brought to bear great gifts of intellect, training, and business acumen in transforming the nation's health system. Dr. Lavizzo-Mourey earned her medical degree at Harvard Medical School. We won't hold that against her, though. And an MBA from the University of Pennsylvania's Wharton School. She completed a residency in internal medicine at Brigham and Women's Hospital in Boston, and was a Robert Wood Johnson clinical scholar herself. She's trained in geriatrics, and throughout her career, she's worked as a physician and agent for social change. And like all good clinicians, she still sees patients at a community health center in New Brunswick, New Jersey. Before joining the foundation in 2001, she served as a professor of medicine and healthcare systems and director of Penn's Institute for Aging. She has been the deputy administrator of what is now the Agency for Healthcare Research and Quality in Washington, D.C., and is a member of the Institute of Medicine. Dr. Lavizzo-Mourey said that she was drawn to the Robert Wood Johnson Foundation by the opportunity, quote, to alter the trajectory and push society to change for the better, unquote. Under her leadership, the foundation has targeted a set of high-impact priorities, such as designing more effective performance-driven, patient-centered healthcare systems and improving quality and safety in patient care. Other priorities that she's championed includes strengthening state and local health departments and systems and halting the rise of childhood obesity by 2015. And most importantly, developing the next generation of health leaders and policymakers. She's worked on the White House Care Policy Team, including the White House Task Force on Health Reform. She co-chaired the Working Group on Quality Care. She served on the Task Force of Aging Research and the National Committee of Vital and Health Statistics. She's also chaired the Subcommittee on Minority Populations, and she's been on the President's Advisory Commission on Consumer Protection and Quality in the Health. Forget all this. She's a great person, and I'm proud to give her the presidential award.
Thank you very much, Linda, especially for that inspiring speech. It was really wonderful. I want to thank George's, of course, and all of you. It is an inspiring group, and there are a lot of you out there as I look around there. It's really, for me, a privilege and a pleasure to be here before you, because I'm accepting this award on behalf of the entire family of Robert Wood Johnson Foundation grantees and partners, many of whom I know are right here in the house with us. And I have to say to Linda that this is especially sweet for us because it's only the first time in 50 years that a philanthropy has received the President's citation. When I looked up the citation on the website, it is a truly impressive list. The citation has gone to some amazing people, heroes sung and unsung, and each honoree was just right for the time. Our own Bill Foege, of course, Rosa Parks, one of my childhood heroes, Nelson Mandela, one of my current heroes, and back in the 1960s, there was a special citation that was given to all the families of public health workers everywhere. To me, that's one that should be given in perpetuity. So obviously, this is a very exclusive club, and I am thrilled to accept this honor on one condition, and that is that you all accept it with me. Because in my head and in my heart, this citation is about all of you. I can't even begin to imagine what the health of the American people would be like if it weren't for you and your colleagues back home. If you just look around this huge, great hall, you'll see that there are thousands of us, and we are bound together by one of America's great common causes, to improve the health of everyone in America, and to achieve equity in that health for all of us. It's where we gain common vision, it's where we find common voice, and it's where I have a favor to ask of all of you. We're all on this road together, and so I want you to join me in the celebration of our collective contributions to the achievement of public health and to the public health profession. I want you to stand up. Go on, if you can, please stand up, all of you. Now let's give ourselves and our colleagues a rousing round of applause. You know, Bill Foege tells us that the philosophy of public health is to find the truth. And the truth is that no one bears a heavier load or faces greater challenges or is more important to the protection of health in America than you. The truth is that our far-flung public health community is more cohesive, more professional, and more ready to confront whatever threats we face, whether they're viral, man-made, or natural. Unfortunately, though, there's another truth, and that is that after all the hard work, all the progress, the most imminent threat to public health turns out to be something that is beyond our control. I'll call it this new age of austerity. Basic public health services are in question. We all know that 44,000 state and local public health jobs have disappeared since the economy went south. Public health and prevention are so far out of the media spotlight that they're a non-factor in the national debate, except when there's a flood or a fire or listeria or E. coli. And meanwhile, the public is more dissatisfied with the way the country is headed at the highest levels than any other time in Gallup poll history. So in some ways, if pessimism were contagious, we would all be infected, but we're not. And here's why. I think the average American sees public health the way they see politics. There was a Gallup poll earlier this month that showed that solid majorities of Americans trust state and local governments to solve their problems better than anyone else. And that tells me this, that this is the best time for you to make your case to local and state policymakers. When times are tough, communities need you. So engage in the process, make your voice heard, use every tool you possibly can, even Hollywood. Yes, Hollywood. You know, last month, my husband and I went to see the movie Contagion. Have any of you seen it? Put your hands up. Yeah, okay, that's about what I thought. Remember that scene when the medical examiner is doing an autopsy on patient 0, and the assistant comes in and says, "Should I call someone?" And he says, "Yes, call everyone." Well, what he really meant was call you, because it's the new public health that's going to get the job done. And I love the way one critic talked about Contagion. He said, "It shows that working together is still possible, still necessary in a world that is divided and partisan as ours is." And that's an encouragement that we all need to receive. And to that I say, right on, because working together has been our message for as long as it's been my job to carry it. And I think at long last, the public gets it too. Americans understand that this is their public health system. They understand that public health has to be properly funded, it has to be state-of-art, it's high-performing, high-quality, and openly accountable, and tightly tied to the communities it serves. And they see how we're upgrading to a new public health that is accredited and accountable to communities and constituencies, that is performing with evidence-based data to improve performance. And they see how public health thrives on partnerships, busts out of its silos, and puts a premium on collaboration no matter who gets the credit. Just think about the theme of this year's conference. Healthy communities promote healthy minds and bodies. Your timing is perfect because just last month, the United States signed on to an unprecedented United Nations campaign against non-communicable diseases. Georges and I were part of the delegation, and we listened as the UN Secretary General told us that 3 out of 5 people on Earth die of a communicable disease. And we know that individual and community poor health is largely determined by social, environmental, economic, and geographic and social factors. We've learned, too, that there's only one way to slow down the accelerating spread of non-communicable diseases, and that's to work together to reshape the cultural, commercial, economic policies and practices that are the unwitting drivers of poor population health. Dr. Margaret Chan, who heads up the World Health Organization, blistered world leaders and called out government and private sector interests for neglecting the health of entire peoples. Listen to part of what she said. Widespread obesity, she said, is a telltale signal that something is terribly wrong in the policy environment. Widespread obesity in a population is not a marker of failure of individual willpower, but a failure of policies at the highest level. That's a message that surely resonates with the theme of this conference and with all of our work. For our part at the Robert Wood Johnson Foundation, we are with you for the long haul. We're committed to helping you secure the 5 essential things that match the imperatives of our time. 1, support as you engage in the political process, evidence as you make your case, funding, private and public, that's both reasonable, responsible, and practical, technologies and infrastructure that are cutting edge, and number 5, the backing of an informed public that knows and trusts you. A vocal public constituency may turn out to be the most essential of all. Now, I'm not going to kid you. The road ahead is long and it's hard, and it will take all the discipline, all the creativity, all the measured management of risk and luck that you can muster. But that is exactly what you do so well. After all, you've been at this a very long time. You're the oldest organization of public health professionals in the world. And simply put, you are too important to ignore, too necessary to neglect, and too big to fail. A few years ago, APHA celebrated its 125th anniversary and awarded the President's Citation to someone else who knows something about going up against the odds, Nelson Mandela. Something he said seems perfect for us in this moment. He said, "The time is always ripe to do right. It only seems impossible until it's done." So my wish for you is that you keep these words close to your heart and close at hand as you return to your tough tasks at home, because your time is ripe, your time is now, and it only seems impossible until it's done. Thank you for this humbling honor.